Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Insomnia, sleepwalking, narcolepsy, snoring. They're all different types of sleep disorders, which can affect your overall health and quality of life. But with accurate diagnosis, doctors can effectively treat many of these problems. Our guests today on Speaking of Health are Dr. Umesh Vyas, Medical Director of Mayo Clinic Health System Sleep Medicine Department in Southwest Minnesota, and Gary Marquardt. He is a polysomnographic technologist and regional manager of that same department. Gentlemen, thank you both for joining us on Speaking of Health.
Thank you very much.
Well, Dr. Vyas, could you first begin by explaining what constitutes a sleep disorder and what are some of the common ones that people have probably heard of?
Thank you, Jason. This is a very good question. Sleep disorders are very common. We spend our 1/3 of life in a sleep. And data supports that 1/3 of US population suffers from one or more sleep disorders in their life. Sleep disorders are very important because it affects your quality of life. And there are many sleep disorders very common, such as insomnia, obstructive sleep apnea, periodic limb movement disorder, restless leg syndrome, and they can affect not only daytime your quality of life, but they can also impact on your medical other conditions like obstructive sleep apnea. If you don't treat, there is a risk for worsening of blood pressure, obesity, diabetes, cardiac conditions such as ischemic heart diseases, cardiac arrhythmias, stroke. So diagnosing and treating them correctly is very important.
And also, just being sleepy during the day can affect a lot of people's quality of life, too.
Oh, absolutely. It can affect your productivity. It can affect your relationship. It can cause drowsy driving, and it can be dangerous for yourself and for someone else on the road.
Well, what is the best way to diagnose a sleep disorder?
The sleep disorders require, first of all, a review of questionnaires, the sleep questionnaires. And any patient who comes to our sleep center, we go through those 7 to 8 pages sleep questionnaires where we have many questions which basically gives us preliminary information to consider whether this patient has some sleep disorder or not.
What are some examples of those questions that you're talking about?
Well, it starts from like a patient name, age, sex, their current occupation, what is their chief complaint, what they think what is the primary problem going on in sleep. Then it talks about what is the time for them to go to bed, how soon they fall asleep, what time they wake up in the morning, how difficult it is for them to wake up in the morning, if they wake up in the middle of their sleep, if they wake up, then for how long they are awake in the middle of sleep, do they snore, has anyone witnessed they are kicking leg in the sleep or they stop breathing. Then some of the symptoms like leg kicking or they have some sleep hygiene issues, whether they're watching TV while they are in the bed. And there is one scale called Epworth Sleepiness Scale score, which basically enumerates the 8 category to know how much they are sleepy or what is the likelihood for them to fall asleep in those day-to-day circumstances, like while you are sitting and talking or while you are sitting and reading or while you are waiting in a public place, something like that. The point I'm trying to make is that first we let patient go through those questionnaires. During the first consultation, we go through them very thoroughly, try to understand what is going on and what needs to be done. After comprehensive evaluation, we do focused physical examination. Patient may need some laboratory workup or sleep study. And that's where basically a patient comes in a sleep center, they go through the polysomnogram, we call it polysomnogram, and we collect lots of data The patient sleeps in a sleep center for 7 to 8 hours, and next day morning, all those data are reviewed by Gary and other senior technologists. And once they are scored, then those sleep studies, they come to us and we review them, we diagnose, and then we discuss about the treatment options.
So based on the questionnaire, the physical exam, and then the sleep study, you can usually narrow down what exactly is occurring with the patient.
Yes. In most circumstances, by that time, we have a pretty much a diagnosis.
Well, Gary, you are the regional manager for the Department of Sleep Medicine at Mayo Clinic Health System. Tell us a little bit more about what Dr. Vyas is talking about and what happens in a sleep lab.
Sure. Well, generally the patients arrive in the evening between 7 and 8 o'clock at night, and they'll be met by their technologist. It's going to set them up with all the electrodes. Some of the electrodes that they'll be putting on are electrodes to monitor brain waves. There's about 21 different little gold cup electrodes that monitor different parts of the brain and tell us what stages of sleep they're in. Many people don't realize that you go through about 4 stages of sleep at night. You have your stage 1, which is your just relaxing stage. Your stage 2, which is your stage where your body's kind of recouping itself. And stage 3 is where it's really getting the job done as far as rebuilding itself. And then you have REM sleep, which is your dream sleep, which most people say they don't ever remember, or some people remember too much. So those are what the brainwaves are doing for us. The eye electrodes are monitoring for eye muscle movement. It kind of tells us when you're in the REM sleep. Your eyes move very rapidly in REM sleep. So it's something we watch very closely to tell us when you are in your dream sleep. We also monitor the breathing through the mouth and through the nose. There's two little sensors that will monitor the air coming out of your mouth and the nose, just to make sure that you don't have that stop breathing part where you have the apnea and so on. We also have bands that go around the abdomen and the chest, and it just monitors your respiratory rate and monitors the rate that you're breathing, so we can see that your lungs and your abdomen are in sync with each other. And we do monitor leg electrodes for some leg movement, leg jerks, such as that.
It sounds like a lot of apparatus.
It is. It is.
Yes.
So
yes.
how do you get the question from patients? How do you expect me to have a good night's sleep if I have all of these things on my body?
We get that question a lot, Jason. Mm-hmm. And basically what we tell them is it's going to be one of the easiest tests you're ever going to do medically. And if you have issues sleeping in a hotel room or anything, you should talk to your physician first. And a lot of times they can prescribe a one-time dose of a sleep aid for that night. Mm-hmm. So.
And in the sleep center, it's a bedroom.
It
right?
is. It is.
It's pretty much a good suite with a good quality bed and flat screen TV and all that stuff. And we try our best to make patient most comfortable so that they can relax and they can fall asleep. Because if they don't fall asleep, then next day morning, certainly I have a difficulty and they have a difficulty to score, and it's difficult to give them a diagnosis.
Now, if we're talking about a sleep disorder like insomnia, where a patient can't fall asleep, how do you monitor that if they don't ever actually fall asleep?
That's a very good question. First of all, if someone has a truly insomnia, that does not make an indication for a sleep study. We do not recommend them to come to the sleep study. There are few other diagnosis such as REM behavior disorder that requires polysomnogram. For insomnia, typically we don't order sleep study.
So not every sleep disorder requires a sleep study in the sleep lab. It's certain ones, sleep apnea, and some of the others, right?
Like restless leg syndrome does not require sleep study. It's a clinical diagnosis.
So Gary, do you also videotape people while they're sleeping? And if so, what's the purpose?
We do videotape people while they're sleeping just because we need to see the patient in case they're needing something at night when they're sleeping, or mostly for the physicians to diagnose if they're having some REM behavior disorders, some movement disorders. It helps them really get a good picture of what the patient's doing in sleep at night if they need to review that.
Great.
And exactly, Gary. In fact, sometime like a seizure, patient may come in a clinic and say they don't know in the sleep what they are doing. So for medical legal purpose also, we need to have those documentation that this patient has abnormal behaviors.
Mm-hmm. Well, Dr. Vyas, can you tell us some more about some of the common symptoms which may guide our audience to know if they may benefit from an evaluation? What are some of the common symptoms?
Sure. If somebody has a difficulty in falling asleep, or they fall asleep but they cannot sustain a sleep, they wake up either because of snoring, snorting, having choking sensation, shortness of breath. If they are waking up early in the morning, if a bad partner is not able to sleep because of their leg kicking, that might be an indication. Or bad partner is snoring so loudly that you cannot sleep in the same bedroom, or the family member needs to go to different room, or it can be disturbing. Then in the morning, if they have a difficulty in waking up, if they have some funny, uncomfortable leg sensations, especially in the evening hours, just before going to bed, all these can be sign of having some sleep disorder, or their sleep cycle is totally off. 5 o'clock in the evening, they become very sleepy and wake up 1 o'clock. That's a kind of an indication for having a circadian rhythm sleep disorder. So there are many sleep disorder. And another thing is if they do some abnormal behavior in the sleep, like sleepwalking, or a child wakes up in the middle of sleep crying, not remembering anything next day morning, that might be an indication for sleep terror. Or come next day morning, or come for the evaluation with the history of patient is getting violent in the sleep. So these all the symptoms indicate that they may have some sleep disorder.
Do you have some patients that come to you and say, oh, I sleep great every night, but for some reason I'm tired all the time, when they have really probably no idea what's going on when they're sleeping?
Yes, this is very common to hear, because patients themselves, they don't know what they are doing in a sleep, and that's a good indication for us to explore and have a sleep study. And in fact, in these circumstances, even interviewing bad partner is very valuable, because bad partner may know that my husband snores, or he is very restless all night long, something like that.
Well, so someone's had a sleep study, or you've evaluated and diagnosed someone with a sleep disorder. What's next? How do you treat someone with a sleep disorder? And I guess it probably varies on the sleep disorder.
Yes, it depends on the type of the sleep disorder. There are many sleep disorders. They are normal variant. They don't require any treatment. And I can give you an example, like somebody needs only 5 hours of sleep. This is called normal variant short sleeper. This becomes a problem when they get married and wife says, oh, by the way, you sleep only 5 hours. Everybody needs 8 hours of sleep. How you have some problem? And they bring to us, and this is a normal variant. Mm-hmm. On the other hand, there are some disorders, they require some medication management, such as restless leg syndrome, or periodic limb movement disorder, or sleepwalking, REM behavior disorder. Versus there are other sleep disorders, such as obstructive sleep apnea, which requires a CPAP treatment, which is basically, it's an equipment which works as a pneumatic splint. It gives you a pressure in your throat to keep your upper airway open so that you don't snore and you don't stop breathing while you are in a sleep.
Great. Well, unfortunately, we are all out of time. I know there's much more we could delve into when it comes to sleep disorders, but I'd like to thank our guests today, Dr. Umesh Vyas and Gary Marquardt from Mayo Clinic Health System.
Thank you very
Thanks
much.
for joining us.
Glad to be here.
Have a great day, everyone, and be healthy.